Good morning, good morning, good morning. Thank you all so much for coming out. Day after Memorial Day, I know it's taken a little bit to just kind of get back into the week. So I don't take it lightly that you all are here. I am Tara Stamps, Cook County Commissioner of the 1st District, and I want to thank you all for being here. It's my honor to stand alongside so many committed leaders and partners as we gather to recognize Mental Health Awareness Month and to shine a light on the urgent and ongoing need for mental health wellness in our community. This work is so very personal to me. As a 25-year veteran educator and lifelong advocate, I've seen firsthand, especially in Black and brown communities, that often go unaddressed, the ravages of unaddressed mental health. Mental health care is not a luxury, it is a necessity. And today, we are standing in the gap for our people, particularly young people who often, and their symptoms often go undiagnosed or misdiagnosed. The purpose of today's resolution, this resolution is just not symbolic. It's a bold call to action. We are here to honor the work of community-rooted partners who have been leading this effort for decades. I've created just recently a new space called Shop Talk for young people to gather and to heal and to speak their truth and to be provided the support and mentorship that they so desperately need. I'm so honored to be a Cook County elected at this point in time because Cook County Department of Public Health and Behavioral Health Services have been a cornerstone in this effort. Collaborative bridges, building wellness and resilience among youth and families, also in the 1st District, led by the incomparable Donald Dew. And the National Alliance on Mental Illness, a beacon for education, support, and advocacy. NAMI has become a really important partner in this work through Cook County, and they've been a partner in Shop Talk, providing training for barbers and hairstylists and mentors to get student mental health first aid training so that not only are they able to have conversations around mental health, they're able to identify some of the traits, some of the conversations that might lead to a deeper relationship and maybe even some one-on-one counseling. And I'm so honored to be in partnership not only with my county family that supports so urgently the need for mental health supports, but also community partners that recognize that right now we are in the middle of a mental health crisis, particularly with our young people. Our children are both imploding and exploding at the same time because that's the danger of pain and unresolved trauma that our babies are killing themselves and each other. And I'm here to just say that whatever happens in our education system, in our mental health spaces, in our job spaces, whatever happens with our young people in this moment will be our responsibility. It will be as a result of what we did or did not do when we saw what was happening with our babies. And so this is an urgent call to action that wherever you are and in whatever space that you occupy, in this world, in this county, in this community, do something. Do something. Talk to our children. Reach out to our children. Talk to mental health professionals and get training that's available for all of us to help. Right now, I would like to thank President Preckwinkle for her unwavering leadership in so many areas that are so critical to the growth and wellness of our state and certainly of our county. We should be proud to be under the banner of her leadership because she and so many other people in this county and state are holding the line on democracy, holding the line on wellness, holding the line on civility, holding the line on humanity, holding the line on what we call elected officials to be in this moment and in other moments, those who see beyond the immediate to the need and taking care of folk in the immediate, but also planning for the future. And so I'm honored, honestly, to be under the leadership of President Tony Preckwinkle. Together, we are breaking the silence, we're eradicating the stigma, and we're building a stronger Cook County together. President Preckwinkle.
Good morning, everybody.
Good morning.
I'm grateful to be here, and I want to thank Commissioner Stamps for her leadership in bringing this critical resolution forward. I'd like to acknowledge not only Commissioner Stamps, but Commissioner McCaskill, Dr. Tom Nutter from our health and hospital system, Hannah Kite, who's Director of Behavioral Health at Cook County Department of Public Health, and Avik Das, who's Executive Director of the JAC. I would ask those who follow me to introduce others behind me who I'm not familiar with. I want to thank all of you for your dedication to expanding access, breaking stigma, and building healthier, more compassionate communities in Cook County. Mental Health Awareness Month is a time not only to raise awareness, but to deepen our commitment to equitable health care and access for all Cook County residents. At Cook County, we take that commitment seriously. Through our Department of Public Health and ARPA investments, American Rescue Plan Act investments, that's the federal money that came to us to deal with the consequences of the pandemic, we're expanding trauma-informed services, supporting behavioral health providers, and advancing innovative partnerships that prioritize community voices. This work is essential and ongoing, and imperiled, I might say, by actions in Washington, the extent of which to be determined. Commissioner Stamps, I want to commend you especially for your innovative shop talk. It's a powerful example of what grassroots, culturally competent care can be like. You've created a space for Black men to address trauma, share wisdom, and begin to heal. That's the kind of leadership that transforms lives and strengthens communities. Thank you again. But we know our work cannot stop here. For far too long, mental health support has been underfunded, overlooked, or out of reach, especially in communities of color. Our efforts should stretch beyond a single awareness month. They must be sustained, inclusive, and designed in partnership with those who are most impacted. Mental health care should not depend on where you live, how much you earn, or whether you know the right person to call. It should be woven into the fabric of our public systems, in schools, libraries, community centers, and clinics. Healing should be visible, accessible, and treated as the necessity that it is. As we recognize Mental Health Awareness Month, I urge all of us, elected officials, community partners, and residents, to stay engaged, to listen, and to lead with compassion. Mental health is public health. I'm going to say that again. Mental health is public health. And Cook County is committed to meeting this moment with the urgency, equity, and empathy that it demands. Thank you again for your partnership and your continued commitment to this critical work. And now I'd like to bring to the podium Commissioner Keisha McCaskill.
Good morning, everyone.
Good morning.
Thank you, Commissioner Stamps, for bringing us all together to discuss this very important and urgent topic. Thank you, President Preckwinkle, for your leadership and vision to ensure Cook County has the resources available to address mental health. I had the honor and opportunity of walking in the South Holland Parade on yesterday. And as we walk in memory of Memorial Day, the streets were lined with kids happy and parents, and everyone was excited. But as I began to speak to the younger men that were on the lines as well with their children, there is a lot of despair. And sometimes what appears to be despair actually is hidden depression, is hidden anxiety. It's us not knowing that they are suffering some type of mental trauma that has not just been exposed. So as we remember those who have gone deceased through veterans or whomever, we want to remember those that are still living, that are currently living these same issues of PTSD in the streets in their communities in which they live. When I speak about refuge in some of my previous occasions, we want to talk about how this mental health is actually not only impacting the men and the younger adults, but impacting the children, and this trickles into the school system, so it's cyclical. So when we speak about mental health, we have to look at it from a holistic perspective, and we must begin to remember that Mental Health Awareness Month cannot just be for this one month. It has to be something that is acknowledged all year long. Mental Health Month only reminds us of the importance of understanding and prioritizing mental well-being. In Cook County, Illinois, statistics reveal that mental health challenges are prevalent. Approximately 1 in 5 adults experience a mental health condition annually. yet many go untreated due to stigma and a lack of access to care. Cook County is changing that dynamic. We're making sure that the care, the access, and the resources are actually reaching the neighborhoods that are impacted most. Suicide is a critical concern. We don't always hear about those that have lost their lives or have given their lives, but 13.3 deaths for every 100,000 people in recent years is the current rate. That's higher than the national average, and that's right here in Cook County. So we've got work to do when it comes to bringing these resources to our neighborhoods. While Memorial Day honors those that gave their service to our county, to our country, it's a time to remember the courage of those who are still living, the trauma that they're currently going through. PTSD, again, is not just for those who've served in war, they're for those who are living in the war. Today, I urge us all to remember those we've lost, honor their legacy, and continue advocating for mental health awareness for those that continue to live, because healing and remembrance go hand in hand. Let's work together to reduce the stigma, increase access to care, and ensure that no one suffers in silence. So I applaud you for Shop Talk, Commissioner Stamps. And I also want to applaud again our Cook County President, because if you or someone you know is struggling with mental health challenges, the county is here to serve you. There are resources dedicated to providing free support. NAMI Cook County has a hotline, 1-800-950-NAMI, which is 6264. There's also the Cook County Department of Health. They offer accessible resources and mental health services, 312-864-7200. It's up to all of us to get this information out. No one needs to suffer alone. Mental health is not a person's crisis, it's all of our crisis. When one person suffers, we all feel the impact. Thank you. And I would like to bring Dr. Tom Nutter, CCH. Thank you.
Good morning. Thank you, Madam President Preckwinkle, for your strong leadership, vision, and support. On behalf of the Cook County Health Office of Behavioral Health, thank you to the Board of Commissioners, particularly Commissioner Stamps and McCaskill, who are here today, to CCH CEO Dr. Makaitis, and all on the CCH board for their support and investment in improving behavioral health and behavioral health care throughout all of Cook County. That investment can be seen in several projects with which our office has been privileged to be involved over the past year. Last year we had the first ever Behavioral Health Summit, and as well as a community needs assessment, and then a joint venture with the Cook County Department of Public Health, a workforce assessment, and then tomorrow we will gather for another press conference to announce the Regional Behavioral Health Strategic Plan for all organizations throughout Cook County, but I'm getting ahead of myself. So for today, thank you for this invitation from Commissioner Stamps, and thank you, Commissioner Stamps, for your advocacy, your leadership, and passion for the mental health, particularly of young people, both those within your district and throughout Cook County. Thank you. I'd be remiss if I didn't mention those who work in CCHHS within our Cook County Health System, both at our 2 hospitals, as well as all our community clinics, the Juvenile Temporary Detention Center, and over at the jail. The work those folks do is nothing short of inspiring. Speaking of inspiring, I'm honored to have Mr. Dew here today, who has spent decades in service to those on the West Side, both in ventures that are long established and some like Collaborative Bridges, which I think we can still call new. So we're here today because the needs of Cook County residents are vast. We're here today because there should be no wrong door for accessing mental health services. And we're here today, though representing many organizations, to say that we are one team. So happy Mental Health Awareness Month. And with that, I'm happy to introduce Avik Das, who leads the Justice Advisory Council.
Wonderful. Good morning, everyone.
Good morning.
Good morning. So thank you, Commissioner Stamps, Commissioner McCaskill, my other colleagues from Cook County Health, President Preckwinkle, for your leadership, drawing attention to the need to support the health and well-being of all our residents, including equitable access to quality mental and behavioral health care. So under President Preckwinkle's leadership, I am proud to lead the Cook County Justice Advisory Council, JAC, in support of our County Board of Commissioners, particularly at the intersection of our public safety and public health system. In collaboration with government agencies spanning the criminal legal system and Cook County Health, the JAC works to bring innovation in justice system reform, but most specifically, critical resources to communities most impacted by chronic exposure to violence and contact with law enforcement, courts, and incarceration. In short, we strive to support the amazing leaders you see here, critical community-led direct services like those highlighted here today, where we work very hard to center and humanize the person and their needs rather than criminalizing them. We recognize that death by suicide or homicides involving guns are among the leading causes of death for our children and young adults. We recognize that exposure to the aftermath of gun violence, unaddressed trauma, and the persistent barriers to accessing quality mental health care disproportionately impacts Black and brown communities, struggling under historic disinvestment and lack of resources. We further recognize that our first responders in law enforcement and emergency services feel the relentless pressure of confronting acute mental health crises and associated harms well beyond the point that coordinated systems of prevention could ensure people have early and consistent access to quality mental health care and support before unaddressed needs translate into tragedy. So the JAC has helped steward the county's unprecedented investments since 2021 of well over $100 million in federal, state, and county funds in community-based organizations, helping those closest to violence and contact with the carceral system access holistic services, including crisis response services and trauma-informed clinical care. Thanks to the inspiring work of amazing community organizations working in Chicago and the suburbs, and the enduring commitment of Cook County leadership, the JAC is grateful to continue to support collaboration that addresses violence as a public health matter, a public health emergency, and equitable access to mental health care as critical to helping our residents experience more peace, more well-being, safety, and success. Thank you. And now I'm pleased to introduce Hannah Kite, Director of Community-Based Healthcare, Mental Health Care at Cook County Health. Thank you.
Good morning, everyone.
Good morning.
I'm Hannah Kite. I'm Director of Community Behavioral Health at the Cook County Department of Public Health. Thank you for including us today in this celebration of this bold and grassroots program to support mental health, essential mental health programs for African American youth and adults. We here at CCDPH, we've had the honor to participate in the Shop Talk sessions, and we've witnessed the healing and connection that happens in these safe and trusted spaces. The mental health crisis is real, and as Commissioner Stamps has said, our babies are hurting. 1 in 3 suburban high school students say that they feel depressed. 15% of suburban high school students have seriously considered suicide. And between 2016 and 2020, the youngest person to attempt suicide was 9 years old. And if we take a moment to think about what this 9-year-old was feeling, what they had experienced, that hopelessness that they must have felt, I think that just underscores why programs like Shop Talk are so important. So we are grateful to Commissioner Stamps for her leadership and to her and to her team for taking decisive action to respond to mental health needs in our communities. And we're also grateful to President Preckwinkle. Thank you for helping move the mic. And for championing behavioral health across Cook County. Her support has truly been transformative. So we're looking forward to seeing Shop Top grow across the communities that we serve. Thank you so much.
Yes, please, Mr. Patrick Dombrowski from Collaborative Bridges.
Good morning, everybody. Good morning. So yes, I am Patrick Dombrowski. I'm the Executive Director of Collaborative Bridges. We are a community care hub that's funded through health care transformation dollars from Illinois Department of Health and Family Services. Thank you. So yes, thank you, Commissioner Stans, for the invitation and the partnership. President Preckwinkle said it best in that behavioral health is public health. And fundamentally, that is reflected in the work that Collaborative Bridges does. You know, it's great hearing everyone's comments, you know, singing the same song, that fundamentally, you know, it is so much more than just therapy. It is, you know, really looking at it through wellness. The work that we do reflects this same kind of approach to care. So we are comprised of 8 organizations, 3 key safety net hospitals on the west side, HSI, C4, Bobby E. Wright, Task, and PCC Community Wellness as community organizations. And really we're trying to disrupt individuals from going back into the hospital, trying to really break up this chronic over-reliance on emergency room care, inpatient psychiatric care. You know, and it is all fundamentally about health equity and ensuring access to care. One core component of what we do, you know, and certainly is how, you know, Commissioner Stamps kind of first heard of us, is we have just opened a wellness center in West Garfield Park. And certainly the design of that and then all of our work and what we see reflected with the county as well is this commitment to really working together to, you know, go upstream, solve the problems, instead of just seeing the same repeated traumas over and over again. So thank you for the invitation. Excited what the county is going to continue to do, particularly under Commissioner Stamp's office. And
thank you. Good morning, everyone. To Madam President, Commissioner Tara Stamps, and the Cook County Board of Commissioners, ladies and gentlemen, my name is Donald J. Dew, and I serve as President and CEO of Habilitated Systems, Inc. I also serve as the board chair for the Commission on the Accreditation of Rehabilitation Facilities, as a board member for the Guardianship and Advocacy Council, and also as a board member for Wellness West and Collaborative Bridges. I reference these affiliations because they have significant impact on the quality of life and mortality rates for thousands of Cook County residents and nationally challenged by mental illness, generational trauma, and chronic medical conditions. You know, I just want to pause and sincerely thank Commissioner Tara Stamps for her unwavering passion, competency, commitment for community, and really being very, very concerned about what's happening with the lives of our children. I've been a part of Shop Talk, and I've worked with the barbers and the children, and I'll tell you something, there's nothing more powerful than to see these children being able to get a good haircut, because everybody want to look good, right? The kids always want to look good. They want to be sharp, you know, for special occasions, for graduations and proms and all that. And they get those haircuts in Shop Talk. But more important than that, they get some real soul food. They get something that they can really digest and hold on to that makes a difference, you know, going forward in their lives to really make them make some really good choices and decisions. You know, I did want to quote just a few stats because it's important during Mental Health Awareness Month for us to understand statistically how important and needed this resolution is today, and why, as has been stated, we must, you know, address mental health concerns not just during the month of May, but every month of the year. According to SAMHSA, the Substance Abuse and Mental Health Services Administration, from 2018 to 2021, suicide rates among Black youth between the ages of 10 to 24 went from 8.2% to 11.2%. In 2021, for Black youth ages 10 to 24, suicide was the 3rd leading cause of death. In the past 25 years, self-reported Black youth have indicated that they have made some type of suicide attempt. 73%. From 2011 to 2021, the percentage of black students injured in a suicide attempt increased as well, while other demographic groups have either no change or have seen a decrease. So when we've heard, stated before that this is disproportionately affecting our black and brown youth, it is significant. It's also significant to say that because of many of these challenges that are experienced within the black community, many of our children are disproportionately represented in the child welfare system and the juvenile justice system. I'm happy to report that when HSI was funded by the Justice Advisory Council for both violence prevention as well as restorative justice, we served over 200 youth. And not one of those youth reoffended and had to go back into the juvenile justice system. Often we hear about social determinants of health, but it's the political determinants of health. It's what our elected officials decide to do. The budget is a reflection of morality and what we care about. And so when our county commissioners come to the table and say that they're going to invest in mental health, it makes a difference. It makes a significant difference. I should also mention that, HSI Habilitative Systems has been serving our community since 1978. And, we're also classified as what we've been able to coin as a historically black community-based organization. And we've emphasized the need for access, quality services within the community, addressing needs like mental health, substance abuse, developmental disabilities, senior and youth services. And, we are very, very proud when we talk about an HBCBO because this concept of HBCBO grows out of, Madam President, the black settlement houses and the historical significance of the black churches, helping just millions of black folks who migrated from the South to the west side of Chicago, to the south side of Chicago, to Cook County in search of the promised land. Yes, it makes a difference when we move forward to care for those who are in desperate need of vital services like those we're talking about here today in mental health. I'm also pleased, Madam President, that the county funded HSI's Westside Community Triage and Wellness Center, where we're able to deflect persons with chronic mental illness from unnecessary institutionalization, incarceration, and emergency room home care. And yes, mortality. Yes, we were saving lives. One of our clients said, "This is the best emergency room I've ever been in." So there is true power in collaboration. We're happy to be working with Collaborative Bridges, and we are happy to be working with Wellness West, Illinois Health Practice Alliance, and so many other different groups who've come together to deal with the integrated needs of the people within our community. It is significant and it is important. I would also want to emphasize the importance of training our professionals. HSI has been able to provide paid internships for a number of graduate students here in the Chicagoland area, but I'm very, very happy to report that Jane Addams College of Social Work at the University of Illinois has graduated over 14 black men with master's in social works degree, and it's significant. It is so significant. So yes, we gotta have culturally sensitive services. We gotta be able to continue to impact upon what's happening with this mental health crisis in our community. And remember, in the black community, there's no post-traumatic stress. It's what we call present trauma. It never stops. It never ceases. Thank you for your attention.
Thank you so much for my guest that took time out of the, did I get everyone? Did I get everyone? Okay. Took time out of their day, particularly President Preckwinkle, whose schedule is very busy, but saw that this was important to make our community aware that this is Mental Health Month. I could not do this work. I don't do this work alone. It was a vision. The Shop Talk work was a vision that was given to me because historically, in all communities, not just black communities, barbershops and beauty salons are just safe spaces. I don't know why that happens that way. I just know that it does. And that over 20 barber and beauty salons have opened their doors to me with this vision to bring young people in to feed them both a healthy meal and to feed their souls so that they are seen, heard, listened to, believed, and belonged, and yes, get a fresh haircut or some beauty treatments while they're there. But I don't do this work alone. I want to thank these gentlemen that you see to my right, your left, members of my steering committee, whom I call trusted adults, have been mentors and have walked me through not only their walk, but what is necessary to perpetuate and to continue Shop Talk, to expand that so that we are able to see more young people, get more young people in the door. And I'm happy to report we are continuing to grow. And as we continue to grow, the need does not lessen. It has not lessened at all. But the idea, well, I wanted to say this. A lot of times, people think change happens in the macro. You have this huge program that helps a lot of people, but not really. I can tell you that the most change I've seen, both as just an elected and certainly all the years that I spent in the classroom, are those small conversations, those come up to my desk conversations, those sit next to me conversations is where real transformation happens. And because that's the case, I challenge everyone under the sound of my voice, whether you're a policymaker, a parent, a teacher, a neighbor, a auntie, a uncle, a cousin, to speak up, to show up, to let's make a real difference in mental health and make it a collective priority, to check in on people, to see people, to hear people, especially our young people. This resolution should spark not just a reflection, but a real response to action, that we participate in the survival, and not just surviving, the thriving of our young people. Thank you all so much for coming out. Are there any questions from the press? Okay, we're good.